So, like I said, with the suicidal behavior, it represented like somewhere between 200 and 400 lives saved. But they didn't just look at suicide.
So this study could have done two things at the same time to two different groups. Do you see what I mean?
This study looked at medication only. It didn't ask about other kinds of treatment. There are other kinds of treatment, and when there's ADHD in kids, the psychological treatment for that is parent training.
Stories, labels, misconceptions, NHS remains a blessing. Created in 1948, we want it to remain great. A podcast where we share our stories, explore solutions in all their glories. They say it's broken, but it's not done. With your hosts Val, Barrett, and Dr. Jeremy Anderson.
Welcome to Stories, Labels and Misconceptions with me, Val Barrett.
And I'm Dr. Jeremy Anderson.
And this week, Dr. Jeremy is taking over the episode. Would you like to say what the episode's about?
So today we're doing a follow-up from last week where I think I mentioned last week that there was this surge in interest in mental health support at universities. And one of the potential reasons for that is there's a lot more people being diagnosed with ADHD. And we talked about maybe some reasons for why that might be. There's probably many factors. But I saw a follow-up article this week pointing out that drug treatments for ADHD have wider life benefits in preventing negative outcomes, at least among people who are predisposed to those. And so I thought I would talk about that. I found that very interesting.
Let's get into today's episode.
Remember last week I mentioned an increase in demand for mental health services at universities, and part of this was driven by increased diagnosis of ADHD. And then I saw on the BBC this week, there was a story showing that the effectiveness of the medications for people with ADHD, and it was saying that ADHD drugs, particularly stimulants like methylphenidate, which is Ritalin, which is the most common prescribed medication, I think, for ADHD, have wider life benefits, studies suggests. So I looked at this study, and I have to say I'm a bit critical of the BBC. I think they could have provided a link to the article if they wanted, but I did find it.
I don't know, did you found it?
I found it was in the British Medical Journal, so I went to the website and looked for it. This was an article, it was released this week in the BMJ, and the title of that study is ADHD drug treatment and risk of suicidal behaviors, substance misuse, accidental injuries, transport accidents, and criminality.
Couldn't they shorten it?
No, I guess not.
Could have tried.
So what's interesting about the study, at least as reported in the BBC article, was that medication for ADHD, it's not just about it helps you sit still or improves your own reported quality of life, but it actually was linked to reductions of instances of suicidal behavior by 17%, substance misuse by 15%,
wow,
transport accidents 12%, and criminal behavior by 13%. And then when they analyzed it for sort of repetitive instances, those numbers went even higher. So there was a 25% reduction in criminal behavior. And so I thought, I don't understand this. Are they saying that they saw like a 25% reduction in their crime rate? I don't think that's correct.
How would they know? If you got arrested for a crime, is there something there that says, do you have ADHD? There's some crime that they don't even report the ethnicity. So
yeah, exactly. So I think what people should do when you see a study like this, and if you're interested, go and find the actual study, because the way it's reported in the media can be misleading or incomplete or confusing. And so I found the study, and I actually used Microsoft Copilot to try to help me understand this, because I'm not an epidemiologist, or I don't do population health. That's not my area of expertise. And so I needed some help in trying to figure out what they were doing.
Yeah.
They had a national level data set. So the study is from Sweden, and they had a data set of something like 140,000 people. with ADHD. And so they compared the group that started on a drug treatment, namely mostly methylphenidate or Ritalin, or who didn't. And so what they found were about, I think it was about 56 or 57% of people started treatment. So it's a good sized group.
It is.
And the findings were reported in terms of, so for example, it says drug treatment for ADHD was associated with reduced rates of first occurrence suicidal behaviors, weighted incidence rates of 14.5 per 1,000 person years. I don't know what a person year is or what that means. I had to actually plug it into AI and try to help figure out what's going on here. So the way Copilot explains it is saying, so imagine we're tracking 1,000 people for 1 year.
Okay.
That is 1,000 person years. If you track 500 people for 2 years, that's 1,000 person years. It's a way of measuring. They found 14.5 suicidal behaviors per 1,000 person years. For every 1,000 people followed over a year, about 14.5 had a suicidal episode.
Before the study?
The study meant in the comparison with suicidal ideation, it was 14.5 in the treated group versus 16.9 in the untreated group.
So
right?
more people in the untreated group try to commit suicide.
Yeah. And so what that means is if you compare people getting treated or not, it seems like about 2 or 3 people per 1,000 person years were saved by putting them on treatment. And so then I started thinking about how do we describe this to people? Because that still seems strange.
I'm struggling with the suicide thing. Can I ask a question?
Yeah, sure.
As soon as I saw ADHD, I assumed everyone in the study has ADHD.
It's a data set of 140,000 people, all diagnosed with ADHD.
So the suicide they've mentioned, what about people that don't have ADHD that commit suicide? Because what this says to me is people that commit suicide have ADHD.
Yeah.
Do you see what I mean?
Exactly.
It doesn't make sense.
No, it doesn't. And I think that's the really important thing that wasn't really addressed in the BBC article. It's this idea of thinking about what are the absolute numbers. So the results do not suggest that individuals with ADHD are likely to experience them. The vast majority will not. For those vulnerable, especially with prior history, medication can reduce their risk, a 17 or 25% reduction. What they're talking about is among the people who, if they're not treated, they go on to do these things, those people could be helped by putting them on treatment, right? It also means if you think you're saving, say, 2 or 3 people per 1,000, if you extend that to 84,000 people treated, they've probably saved 200 people a year. It was a 2-year study, probably saved 400 people.
Can I ask another question?
Sure.
What if now, because it says ADHD treatment, we know through previous episodes when we've talked about certain medication, like the blue pill.
Viagra?
Viagra wasn't initially made for what it is used for.
It was originally a blood pressure medication.
So what I'm saying now is the ADHD treatment, if this is the result for people with ADHD, I think it would have been good if they had done it side by side with people that have probably tried to commit suicide in the past that don't have ADHD, to see if that treatment alone can work for people that don't have it. If the outcome has already shown that it's lessened people with ADHD trying to commit suicide. Am I saying it right? Do you know what I mean? I know it's a treatment for people with ADHD, but we know that there are treatment that are originally made for certain things are used for other things.
The treatment for ADHD is a stimulant. right? That sounds counterintuitive. If you think of someone with ADHD or attention deficit hyperactivity disorder, if someone's super active, why would they need something to stimulate them? Wouldn't you want to calm them down?
Do people want to be calmed down?
No,
Is that
exactly.
an issue? Is that an issue? Some people say, I'm too much. So bloody what? Is that an issue? No, it's not.
Well, if you tried to calm people down with something to depress them, that would probably actually make it worse, because the idea with ADHD is their brain is under stimulated. It's not regulating itself as it should. And so the hyperactivity, the self-stimulation, the distractibility, that's actually the brain's attempt to stimulate itself, to better regulate itself. The metaphor is, if you've ever had a car where the engine idles too low and is prone to stalling.
Yeah.
What you do when you have a car like that is you're always revving the engine, trying to keep the engine running fast enough to keep going.
Yeah.
And if you could fix the motor, you wouldn't have to keep revving it, right? But we need to keep it going so it stays steady. And that's the idea that stimulants are having with ADHD, is they're providing a little extra stimulation so the person can actually sit still. They don't have to constantly be distracted.
But some people's ADHD work to their advantage, depending what it is they actually do. Because it's stating to me that society says you have to be a certain way, or we're going to medicate you.
Right.
To bring you down, you're more acceptable, which I think is wrong in many cases.
Yeah, I think what's interesting about the article is that it's not merely about, okay, we're going to over-medicate you just to make you acceptable. If you choose to take this medication, now we're medicated against their will. But what it's saying is that actually, and I'm just grabbing some of the results here. So, like I said, with the suicidal behavior, it represented like somewhere between 200 and 400 lives saved. But they didn't just look at suicide. They looked at, I'm just looking at recurrent behaviors. There were probably 1,750 fewer instances of substance misuse, almost 600 fewer accidental injuries, about 650 fewer traffic accidents,
again,
and nearly 2,200 fewer instances of criminality. Again, what?
Okay, say somebody just caught this part of what you're saying.
Yeah.
This could be related to any group. I'm trying to look on the other side. It's like we're labeling, even though, we will talk about that. We're labeling people with ADHD and thinking of crime, the worst possible things. Loads of people out there do crime. I personally don't know if they have ADHD.
Yeah.
What am I trying to say? This treatment, if the outcome has presented all of this, then this treatment could be used on a different group that don't have ADHD, because if it's brought down the numbers of people committing suicide, people being run over, people committing crime, substance abuse, that happens anyway.
Yeah, I think it would be worth seeing if these medications could help. If someone with ADHD takes Ritalin, they can focus better and get a higher score on their exam.
Yeah.
It might be that people who don't have ADHD, if they take Ritalin, they can focus better and get higher grades. So it could be that this medication is actually just good for everybody.
An example, the weight loss drug for people with diabetes. They've changed the study now about weight loss. So this study could have done two things at the same time to two different groups. Do you see what I mean?
Yeah.
And it would have made a better study. But no.
Yeah, that's a perfect example. You have a medication that's designed for people with diabetes. And yes, it does help people with diabetes, but it really helps with weight loss. And it can help you with weight loss even if you don't have diabetes.
Yes, exactly.
And I think this study was really interesting for me because it was using this target trial emulation. And so it was this data set. So if you had a drug and you wanted to see what's the effect on people, in this case with ADHD, do they take it? Do they not take it? What's the effect? The gold standard that you would use would be what's called a randomized controlled trial, where you take two groups of people with ADHD and you randomly assign them to either get the drug or don't take the drug. And by making it random, so no one can choose whether they take the drug, and you compare the two groups, that's the gold standard. The problem with that is you can't do that practically, ethically. You can't just make someone take a drug whether they want to or not, nor can you deny people the drug if they want to take it, if it's a bona fide treatment for them, right? So you can't do that. But what they did was they did this interesting statistical method where they assigned people to both groups and did some complicated statistical weighting to make sure the two groups are the same at baseline. They followed people for 2 years to see what they did. Did they take the drug or did not? They eliminated them from the other group. And by doing that, and with this statistical weighting where they remove the variation between the groups, it mimics randomization, even though they can't actually randomized. So it's not quite as good as a randomized control trial, but it's a lot better than just watching and seeing what happens. So it really does produce more conservative estimates. I just found it a very interesting study from a statistical point of view. But I think probably the thing to emphasize with this is, what they're not saying, people with ADHD are particularly likely to commit crime or get into accidents. We're talking about 2 people out of 1,000. It's a very small number.
Very small.
That is very small, right? I think they're saying 14 to 17, a difference of 2 or 3 people out of 1,000.
Yeah.
Right? If you expand this to 85,000 or 140,000 people, well, the numbers get big. Saving 400 lives, that's pretty good. It's not the biggest effect, but not having 400 suicides every couple of years seems important, no?
Do you have the figures for people that commit suicide?
In the figures overall?
Yeah.
No, I guess I would need
One
it
second.
for this was a Swedish study saying in 2 years there'd be 200 or 400 fewer suicides. I don't know how many suicides Sweden has in a year.
It's supposed to be high in happiness. Every year, more than 1,200 people die by suicide in Sweden.
Sorry, 100,000? 1,000, okay.
1,200.
1,200 die.
Yes.
And I suppose for everyone who dies, there's probably a lot of attempts, right? There's probably a lot more attempts than there are people who complete suicide.
Yeah, people who die. Yeah. Additional 300 are classified as underdetermined intent, of which many may have been suicide.
Yeah.
In 2023, 10 children under the age of 15 died by suicide.
Yeah.
Wow.
Yeah. I'm just looking this up now. So if we look at Sweden, the numbers I'm getting is in 2022, Sweden recorded 7,383 suicide attempts requiring inpatient care.
Yeah.
I would expect even more suicidal behavior, self-harming, but maybe weren't hospitalized.
What I'm trying to say is I don't believe, and you might not believe, the only people that commit suicide have ADHD.
No,
I don't know if it's because we're more aware of what ADHD is.
Yes.
More people, especially adults, are probably self-diagnosed. This is from what I've read. I'm not saying it myself. This is what I've read. Are self-diagnosing.
Yes.
And not being officially diagnosed.
Yes. So there's a few different things going on there. One is there's greater awareness of it. Some people are self-diagnosing without the diagnostic process. The criteria for diagnosis have changed. So I think we talked last week, it's become a spectrum. So it's actually easier to get a diagnosis than it used to be. And that might be because maybe we're overdiagnosing, or maybe the diagnosis was always there. We were just missing it before, right? Or maybe we're actually living in a society that, for whatever reason, the way it's structured, it's actually creating more ADHD than we used to have. So there's probably many different factors that contribute towards the diagnosis. But I think what this study shows that even if we're concerned about over treating people, we should know, particularly for people for whom this kind of stuff is an issue. Like if someone is already self-harming, getting them, if it seems like they also have ADHD, getting them on treatment could be really important.
Because, of course,
because
I'm not denying.
If someone already has a risk factor, this could help them or prevent disaster.
What treatment do you think is only medication is the best way?
This study looked at medication only. It didn't ask about other kinds of treatment. There are other kinds of treatment. And when there's ADHD in kids, the psychological treatment for that is parent training. It's teaching parents things they can do to help the child learn to concentrate. If diagnosed as an adult, there are things the person can do to help practice paying attention. And I'm reminded, in fact, there was one, I think it's for ADHD. It was a FDA approved video game they call a digital therapeutic used for treating ADHD. And what they found is that by having kids playing this game, which it basically required them to perform a game task, practicing kind of divided attention. So they really had to concentrate and pay attention to a couple of different things at once and really practice focusing on one thing despite being distracted. And that was very effective. So there really are things people can do
before they go down the medication route.
Perhaps. Yeah, or even if they have taken the medication, maybe it doesn't work, or there's some other reason why they don't want to take that medication.
Exactly.
They could do something so they could stop taking the medication.
Don't you think sometimes as a society we should try not to always go down the medication route before we try other therapies? I don't know.
Yeah.
That game you mentioned.
Yeah.
Some children just have a lot of energy.
Right.
Does that mean that child has ADHD or just a lot of energy?
Yeah.
And just needs to be doing something. Burn off that energy, use their mind, whatever it is. I'm just conscious of the fact that we seem to rely on medication.
Yeah. Well, we don't know everything about this condition. There's a lot more that we could do to understand why people have it, how they get it, and what can be done to fix it. No, I wouldn't say medication is certainly the only thing that we should be doing.
I'm picking up on that. Fix it.
Yeah.
Some people, I'm going to be on the other side now. Nobody here has ADHD. It's when people say things like that with people with disability. Let's say a person with ADHD might say, fix what? I'm not broken.
Yeah.
It's like when that new bill was passed, the new dying bill.
Oh, assisted dying.
The assisted dying bill.
Yeah.
People are afraid that it will move on to people with disabilities, some of the elderly. It's this fixed thing. You're broken, not like the majority. Therefore, we have to fix you. When some people, it's to their advantage. My son has learning needs. And people used to look at him and say, oh, why does he say certain things? Why does he act a lot younger than he is? For years, I thought I had to fix him because of people's attitudes. And I realised, no, I bloody well don't.
Yeah.
You need to be fixed with your attitude.
Yeah.
Our attitude to others, our attitude to people that don't look like us, that don't behave like us.
Yeah.
Don't sit still. So what? See, it's not the end of the world. When you think of what a lot of people are going through, somebody being fidgety, I don't know. It's up to families to decide. a parent can go to the child's doctor, and doctors might say medication. Parents need to know there may be other choices.
Yeah.
Because each case is different.
Certainly, if we're talking about adults getting diagnosed, I wouldn't want the message to be that people need to run out and get medicated because otherwise they might commit crimes or kill themselves or have a car accident or something. If you're someone who just has a diagnosis with ADHD and never had those problems before, you probably won't have those problems, right?
Exactly.
Because they've never happened, right? But if you're someone who has a couple of DUIs, has had a couple of accidents, maybe beat up their partner because you get angry and you're not regulating your emotions, and you just got a diagnosis of ADHD, maybe you want to consider treating that, even with medication. You might, but maybe if you're someone who just finds it difficult to make good choices because of your ADHD, maybe you'd want to get treated because you don't want to go back to jail.
Can you hear barking? It's loud.
This is I know my microphone picks up everything. Sorry, I am just going to go grab her because she's getting stimulated by somebody. Maybe she needs some medication.
Don't you dare.
So maybe she needs some Ritalin. Little sausage dog.
I'm just going to give you something I found online. It's got nothing to do with having ADHD, but it's about suicide rates.
Okay.
I'm going to give you a quiz.
Mm-hmm.
Do you think between Russia and Greenland, which has the highest suicide rates in the world?
Between
Russia and Greenland.
The highest rates. I haven't looked at anything like that. I'm going to guess Greenland because the population is very small. You tend to get big swings.
It is Greenland.
They have population.
59.6 per 100,000. And Russia has 24.1 per 100,000.
Yeah, the Russian suicide rate must be higher because they keep falling out of windows, right?
But Greenland is the highest. Greenland, Guyana, Lithuania, South Korea, then Russia. Wow.
Well, that's it. And it's from really places. There's some very northern, like Greenland is very far north. But then you have Guyana and South Korea, which are relatively more equatorial.
Mm-hmm.
So it's not a seasonal affective disorder kind of thing, like a lack of sunlight. But yeah, big cultural differences.
Blimey. So it's a big difference. The UK is way down on the list. Way down. We've got 8.47 100,000. Does that say what year? Yeah, which is low. But people are still committing suicide. But then that doesn't add up the ones that have been trying.
Exactly. Yeah. I was interested in this procedure. Yeah. Just this way of doing an observational study. I thought the way it was originally presented, it was very much a kind of this thing causes another thing. And I thought really to make a causal argument, you really do need the randomized control trial. And it took me several rounds.
What is a randomized control trial compared to another trial?
Yeah. If you just had two groups of people, one group chooses to take the drug and another group chooses not to. And you just see which group has a different effect. For example, for anything, not just ADHD, but if you found a difference in outcome, like one group had more heart attacks or one group lost more weight than the other, right?
Yeah.
You could conclude the effect was the drug they were taking.
Okay.
But you don't know that.
You don't know the diet.
The same people who take the drug are also more likely to eat healthier, or they're interested in health generally. Maybe they're more likely to exercise. Just because you see a difference in the group doesn't mean that you can be confident that the difference is because of the medication. You haven't ruled out other things.
Okay.
And we know there's the placebo effect. if people think they're getting treatment, they report feeling better.
Yeah.
Even if they're not. Maybe that's accounting for the difference. To control for that, you don't let people choose whether they get the treatment or not.
Okay.
You randomly assign them. You don't decide all blondes go in the treatment group and brunettes are in the placebo group.
Didn't do this.
No.
No,
They
sorry.
didn't.
Okay.
Right? So with the ADHD study, no, that's not what they did.
Why? I thought they had two different groups.
Yeah. So that's the interesting thing, right? For some kinds of studies, you can do this randomized controlled trial where you control all factors that you think could be influencing the outcome, including you randomize people to which condition. For some, if you're looking at a drug to treat hair loss, you can randomly assign people to that. That's an elective procedure. Nobody's going to die because they do or don't get their hair back.
Hair loss, right? To begin with, haven't you?
Yeah, you probably have some hair loss to begin with, right? So you can randomly assign people to a condition. But there's other things that, for just practical reasons, ethical reasons, you can't. Or the study was 140,000 people. There's no research study. That's a huge number. It wasn't that they recruited people, put them in a group, and decided what drug they got or didn't get. What they did was they had a data set. They just had a list of people that have ADHD.
Oh.
Right?
Yeah.
And then they just follow the data, because in Sweden, there's all these data reporting things. So they get a bunch of data, look at these people, follow them over 2 years and see what happens.
Okay.
It was hard to wrap my head around exactly what are they doing that isn't just seeing whether people take a drug. How is that different from people choosing on their own? How does that deal with threats to validity?
Did these people know they were on a study? Or were they just skipping the medication? Did they go to a centre and watch them take it?
No, so they would have been prescribed the medication by their GP.
But prescribed something. How many times? Because I'm guilty of being prescribed a medication, taking it halfway through, feeling better, and I stopped taking it.
Yeah, so for 140,000 people, there was nobody making sure they take their medication. But if someone is in the treatment group, the moment it's reported they stop taking medication, they're weeded out of the study, checked out.
How do they know they stopped taking the medication?
It's reported they stopped, right?
So it has to be, it's reliable being reported.
Yep, exactly. A lot of these things, there's always issues of self-report.
Really? When I look online, when I look at studies farmers are doing, they may give you the injection, give you the medication. You go home, they follow you up by phone call, video call, whatever. But the main thing is they see you take it. Do you see what I mean? That's why I find this a bit weird.
This is population health.
It's a shame because it was a large amount of people in the study. They probably couldn't have done it any other way, which means should they have been so ambitious in the amount of people that they had on this study? Because if you're going to do something like this, you want it controlled at some sort. So you bring the numbers down. I don't know why they were so obsessed with having such a large number.
It's because they're population health researchers. That's the level of analysis that they're working at. So the question isn't about individuals, but a population.
Yeah.
What is the result going to be? They found a small result, but significant because it is just so many people involved.
Yeah.
They found some people stopped taking their medication. They chucked off the study. The way they omit people who don't follow the protocol, or at least as they're aware of.
These people have ADHD. And they expect them to follow the protocol, please.
That's a good point. But it could also be that someone who at some point they weren't taking the medication, but then at some point they decided to take it, they get chucked off as well. This tends to reduce the impact of selection bias. And so that combined with complicated statistical weighting means they tend to get two groups that are fairly equal, which kind of mimics the randomization part. So I thought it was a clever way. It's not as good as a real randomized controlled trial,
Yeah.
but better than naively noticing one thing followed another. Is an improvement. That's just the way population level health research is done. I didn't understand it.
Yeah. It's going to get pulled apart.
I had to wrap my head around this because I'd never heard of it before. This isn't the kind of research I'd been trained in. It took me quite a bit to try to understand what exactly are they doing here. It seems they've got an interesting finding, and the next thing would be to do an actual randomized controlled trial, measure fewer people but more practical. If you could actually control or see whether or not people are actually taking their medication, it'd be expensive, but might be worth doing.
Does it say when this study was done?
It came out on the 13th of August in the British Medical Journal. So yeah, it's pretty prestigious journal.
So that's the end of the episode. Let's look at our labels and misconceptions. The label is, from what that study says, people with ADHD commit a lot of crime. Yeah,
I think my label would be ADHD. That's a diagnostic label.
Oh, yeah, you did it. And did you do your misconceptions?
The misconception is that people with ADHD are more likely to suffer from these things or do things like commit a crime or get into a car accident or kill themselves. They're not. The vast majority of people with ADHD did not do any of those things. I seem to be long-winded today.
Thank you. That's it for this week's episode. Follow us on our socials. Please subscribe.
No.
Toodles.
Okay. Bye-bye now.